Men who have sex with men and transgender people make up an alarming proportion of new HIV infections in Asia. In Pakistan, these key populations have traditionally been neglected in national HIV responses. But that's beginning to change, thanks to the work of Naz Male Health Alliance, with the help of the UNDP and the Global Fund. These efforts are part of a regional HIV program covering 8 countries.
Naz Male Health Alliance is Pakistan's first and still the only community-based MSM and transgender organization working on the health and human rights of the community. We started in 2011 under the Global Fund Project DIVA and have now expanded our services to 5 cities across Pakistan, where we have 6 drop-in centers which house about 220 staff members. The biggest challenge is the stigma and discrimination that the community faces when they go to a government treatment center or even a private hospital. That impacts the MSM and the transgender community a lot more than it would the other populations. And a lot of times they just will not go. And that's where we come in. Our work has been very important because our clinics that we have across the country are community-led. Each of the drop-in centers is actually divided into 2 parts. One is for community strengthening purposes, where the community can come and hang out. It's a safe space for them. The other part is the clinic. We have trained psychologists there also for psychosocial support. In addition to that, we have an STI specialist who comes in daily to diagnose and treat various different sexually transmitted infections. And via outreach, we are also distributing condoms and lubricant, for the very first time lubricant in Pakistan actually. Before this in Pakistan they had never really seen the value of and the importance of lubricant along with condoms.
For maximum impact, the drop-in centres and clinics are strategically located in close proximity to hotspots of high-risk behaviour and are set up to focus on either men who have sex with men or transgender people.
इस इदारे की सहूलतें बहुत अच्छी हैं, जस्ट लाइक कि पहले मैं कॉन्डम्स नहीं यूज़ करती थी, अब मैं कॉन्डम यूज़ करती हूँ। इधर आके ये चीज़ का पता चला, बीमारियों का पता चला।
क्योंकि ख्वाजा सराओं के लिए पहली दफ़ा ये ऐसा इदारा बना है, ऐसा प्लेटफार्म बना है कि जिस पे हम अपने दिल की बात हर जो कुछ भी है हम सब बोल सकते हैं। उधर हॉस्पिटल बाहर जब हम किसी से मेडिसिन लेने जाती हैं, किसी हॉस्पिटल में चली जाएं तो वो हमें ठीक से देखते भी नहीं है, उल्टा मजाक करते हैं कि आप तो ख्वाजा सराओ, आप भी यहाँ पे क्या करने आ गए हो। डॉक्टर नर्सें सभी मजाक करते हैं। तो यहाँ पे आती हैं, हमें हर तरह की सहूलत मिलती है, पानी में अच्छा खाने पीने के लिए चीज़ें भी मिलती हैं।
We are providing services of behavioral change communication through the outreach services, also the distribution of condoms and lubricants, and providing services of voluntary counseling and testing of HIV and the treatment of sexually transmitted infections. Also, we provide the continuous training to build the capacity of the staff. Furthermore, we have standard operating procedures of clinical services and of outreach services as well to ensure the quality.
जब ये चीज़ स्टार्ट हुई तो सबसे बड़ी हमारे बेनिफिट थे कि हम कम्युनिटी मेंबर स्टाफ थे।
और मेरी रिस्पॉन्सिबिलिटीज़ ये हैं कि हम लोग यहाँ से जाते हैं अपने हॉट स्पॉट्स पे, ठीक है, और वहाँ पे जाके सबसे पहले हम लोग MSM को और MSW को आइडेंटिफाई करते हैं
और कम्युनिटी के घर पे ही जाके हम लोगों ने डिस्कस करना था और अपने काम के बारे में बताना था, अपने विजन के बारे में बताना था कि ये मसले मसाइल क्या है, ये बीमारी क्या है।
और उसके अलावा हम लोग उनको IC मटेरियल देते हैं। IC मटेरियल देने के बाद हम लोग उनको यहाँ पे आने के लिए DIC पे आने के लिए उनको फोर्स आमादा करते हैं कि वो लोग यहाँ पे आए और अपना HIV का टेस्ट करवाएं ताकि उन लोगों को अपनी सेहत के बारे में पता होना चाहिए। और
हम लोग यहाँ पर डॉक्टर के साथ कंफर्टेबल होकर बात कर सकते हैं, लेकिन हम लोग बाहर नहीं बात कर सकते डॉक्टर्स के साथ ना। वो पूछते हैं कि अपने घर वालों को बुलाओ या किसी को साथ लेके आओ, कोई मसला है ना तो आप किसी अपनी फैमिली को साथ लेके आओ। ये हमें ये बात का पता है कि ये डॉक्टर अपने बात कंफर्टेबल होकर सुनते हैं हमारी बात।
I take care of the drop-in center. I have to talk to the clients before they go to the psychologist, and when they enter into the DIC, I have to talk to them. I have to tell them about our program, about our project, and what do we do. And if there are new clients, I mean, if they haven't been told about this from field workers and all that, so I have to guide them about condom usage. I have to guide them about HIV, what is HIV and how to get tested, and what is an STI, and what is the importance of, this program, and what could be the impact of this program on their lives. We do arrange certain discussion forums. I mean, we keep the clients involved in a stuff so they don't get bored of the routine. Because over here we do have certain limitations, so we have to offer them some attractions so they keep on coming.
Before this, the government was only focusing on the male sex workers and the hijra sex workers. MSM and transgenders were not even recognized in Pakistan. Now, because of our work, it is the government themselves who has recently said that for the very first time in Pakistan, since the development of NMHA, they have started seeing a significant number of registrations of MSM and transgender people living with HIV in the government treatment centers.
Up till now, we have registered 58,000 MSM and transgenders with us, which is itself quite a huge amount from 5 cities of Pakistan. And almost 12,600 community members have been tested for HIV, and 7,300 cases has been treated for STIs. In fact, this is a quite huge numbers.
We are reaching population which haven't been reached previously. The process is very, I would say, transparent, and it's very organized. We do have field workers, then we have field supervisors. We have a proper map of the city. We do have hotspots where we know that sex work is being done. And now people have started coming to our drop-in center. Now I can see that people are using condoms, plus the community members are much aware of their human rights, about their basic rights. They have started studying further. They are doing their they're doing their next level degrees and all that. They're looking for jobs.
I'm seeing a future of Pakistan where feminine boy is not getting judged on the basis of his gender and sexuality. I am seeing a future of Pakistan where a HIV positive client is going to the government treatment center and he is not being judged or not getting discriminated on the basis of being PL-HIV, and he got a proper treatment.
The Global Fund has given the MSM community and transgender community in Pakistan a sense of belonging. They have an organization that they can call their own. This organization is owned by them. The capacity has been built to such an extent that they now have ambitions. They're wanting to move ahead in their life and do something productive. I think the enabling environment that the grant has created, it cannot be matched with any other project that may have been implemented in Pakistan before.